Good morning. Today we will be discussing childhood obesity, a very complex problem that is gaining momentum and whose incidence is increasing not only in the United States but also in Europe and the rest of the Western world. Childhood obesity is multifactorial with regards to its causes. Recently, science discovered that there were 2 genes that were present in children with obesity. However, possessing the gene does not necessarily mean that the disease or the malady will emanate. It all depends on whether the gene gets activated or turned on or not. The way the gene becomes activated is through overeating or overfeeding as a child. The complications of childhood obesity are pantheon, resulting in strokes, heart attacks, diabetes, high blood pressure, high cholesterol, sleep apnea, arthritis, etc., and the list goes on and on. For the first time in recorded medical history, obese children and adolescents are taking the same medication as their parents for the maladies that were just mentioned. It is an issue and a problem that is growing dramatically and needs the attention of every single one in the United States, from the government in Washington to the local governments, to the food industry, the advertising industry, physicians, the schools. Churches, synagogues, and mosques are all important venues where this severe situation of childhood needs to be aggressively managed. When a child is born, usually they are fed with milk, whether nursed or substituted, or the substituted type. And after they begin eating solids, it is the parents who begin feeding the children the solids. Depending on what type of food is fed to them, so will the child's habitus or stature grow and become obese or remain normal. The parents are encouraged to feed their children correctly. The school lunches were recently modified, thanks to the First Lady, which will mean that the children will be eating a more nutritious lunch. But the parents encourage the obesity by buying the high fructose, white flour, prepared foods and serving that to the children rather than the fruits, the vegetables, and the protein that is available on the periphery of a supermarket. We understand that it is within this lower socioeconomic group of our country whose children suffer most from childhood obesity, because those types of foods that they feed them are relatively less expensive than the others mentioned. The impact on the healthcare dollar at the governmental and insurance level is beyond imagination. Childhood obesity with all its complications, can cause a system to become bankrupt as the complications are numerous. As medical science develops, more and more expensive techniques and investigations and treatments are performed, further compounding a problem of healthcare dollar expenditure. There are other causes involved in childhood obesity other than just physical, and to that we talk about severe psychological traumas that may have occurred when the child was extremely young, leading the child to subconsciously compensate and ease the pain by overeating. That is exactly what happened in our case, inasmuch that sexual molestation by a maid led us to overeat. At that early stage, however, we could not comprehend the reason for the overeating. But in many years later, having studied in the medical sciences and with particular psychological behavior of the human being, we then realized that this was the basic cause. Our specialty is guided imagery or visualization or self-empowerment. Children are extremely given to visualization and guided imagery. Our other modalities of practice are nutrition and exercise. Using those three modalities, we feel adequately equipped to treat obesity, both of the childhood and adult variety. A child can relax very easily, and when psychologically relaxed with guided imagery, they are given to discussing events in their life that were traumatic. They, as well as adults, feel it far easier to communicate in a state of extreme relaxation with guided imagery and medical hypnosis than by speaking on a one-to-one basis in a non-relaxed state. We volunteer all our services to the prevention of childhood obesity, and we ask that every single individual in the United States play their respective roles in trying to combat the disease. The psychological effects might have caused the childhood obesity, but once a child is obese, further psychological trauma develops as a result of the child being bullied by his or her peers. The children are virtually excommunicated from all sporting activities as they are overweight. During this time period when their peers are playing outside and enjoying themselves, these children often go indoors, watch television, and chew on the junk food. A vicious cycle is developed and will continue to develop if immediate action is not taken forthwith. Thank you.